Hi, I'm Dr. Nidhi Jain. I'm an obstetrician and a gynecologist with more than around 11 years of experience. I'm attached to Artemis hospitals and I perform all kind of obstetric and gynecology procedures. I have a special interest in pregnancy and all the pregnant ladies. It's our job to give them the best of our services. Pregnancy is a very new kind of thing which happens in any lady's life. It can change her life altogether with a lot of things happening in the body which sometimes patients don't really understand what's happening. So we teach you how you can go ahead with your pregnancy smoothly and what all symptoms can really mean what, how to tackle with them. Like for example, some lady comes in the first trimester with vomiting. It is very easy for any of the house members to tell that the lady is not eating anything and she is not liking and she's not taking care of herself. But actually understanding the psychological status of the patient, vomiting in pregnancy can be really troublesome and it can lead to a lot of problems. It can even affect the baby. So giving a simple medication in pregnancy can really help that. So that's how giving a proper guidance to the patient is important, and that's what we do. I will be giving a brief gist of labor and delivery process. Patients, especially who are first time pregnant, have a lot of questions in their mind as to what will happen during labor and what medications will be given, how the pain will come and how the monitoring will be done, what kind of pain relief can they expect in their labor process, and when will the delivery happen, so on and so forth. So we can always do guide the patients in the OPD, but this video will help you to understand better. So usually when a normal low risk pregnancy patient is around 38 weeks of pregnancy, we advise them for admission 38 to 39 weeks. That is the time of maturity. And if the patient is in labor on her own, that's very good. Then they just need some augmentation with syntocinon or some mild medication. If they are not in labor, then we do give them some artificial pains, which includes giving them a gel or giving them a medicine. Now, once you are in the labor room, a CTG monitor is put on the tummy, which monitors the baby's heartbeat continuously. And that is put continuously without any break. Only when the patient is getting up from the bed, we take it off. So basically, it helps us to understand the heartbeat pattern of the baby with respect to the contractions. And that's how we go ahead with the labor process. So every 2 to 3 hours, the patient is assessed, the contractions are seen, and a vaginal examination is done. Depending on the progress in labor, we may or may not repeat the medication in 3 to 4 hours. So the first phase of labor is called the latent phase, and the next phase is called the active phase. So when the patient reaches into active phase, that is when the cervical dilatation is around 3 to 4 centimeters. If the patient is insistent, we can give her pain relief that is called epidural analgesia during labor. This is basically an injection which is given in the back and it's given by the anesthetist. It will continuously deliver the medication till the patient delivers, and it has quite a bit of pain relief. The patient is relieved up to 60 to 70%. So basically the sensation does not go, the patient's motor activity is not affected, only the sensory nerves are anesthetized. It's actually very good because the patient can continue with the labor process without any hassles, and she is not very exhausted, especially when she has to push during her delivery. That time she is fresh. The only thing is that during epidural, when we are giving the patient epidural analgesia, we need to monitor her pulse and her blood pressure and the baby's heartbeat, of course, continuously. And if everything is fine, we continue with the process. Constant monitoring with a good labor room staff and a good obstetrician all the time is very important, so that if there's anything, we can immediately take the patient for cesarean. By anything, I mean the fetal distress part. Fetal distress can happen anytime during labor, and that needs an emergency delivery. In that case, we do an emergency cesarean section. But if the heartbeat of the baby is fine, we usually don't do anything else. We just continue the labor process and we wait for the patient to get fully dilated. So when the patient is fully dilated, at that time, we usually taper the epidural or we stop the epidural so that the patient can push with all her strength. She feels the baby's head and she can push. And that's how the delivery happens. After delivery, during delivery, to aid in the delivery, we give a small cut in the perineum to aid the baby's head to come out, which is later on sutured. And most of the times, the bleeding is within normal limits and the patient is monitored for 2 or 3 days and then sent home.